Okay, so now we're moving from the kind of what midwives are doing with physiology, and we're going to go on to love that birth physiology. And I'm delighted to welcome Molly O'Brien, who's come to share her love of birth physiology. And again, this is an edited highlights of her CV, because she's a very experienced and a very interesting person. Totally. She's a midwife, associate lecturer, creator and teacher of biomechanics for birth courses for birth professionals and associates, and a birth preparation class called Moving for an Easier Birth. She's a very experienced midwife. She's been a hypnobirth and birth preparation teacher, associate university lecturer. She's created courses for midwives and birth associates. And this has all come from her frustration with how birth was being managed, if I've got this right, Molly,
Yes.
and has realised that there's a better way. And some of this is about us understanding what normal physiology is. So I was delighted that Molly could join us this afternoon. So I will say to you, Molly, the screen is all yours.
Thank you, Sue. And it's really, I think the programme was very well set out, because I loved what Claire had to say, and the last thing she said, in fact, about the observing and listening to the woman and the birthing person. It means so much, and in fact that's where I got a lot of my information, so I could actually create these courses about biomechanics for birth that came from watchful attendance. And I think that's a real midwifery skill that has been lost because, well, of lots of reasons, but I'll move on from that. That's another discussion. Thank you so much for giving me the opportunity to talk about my favorite subject, and that is birth physiology. And something that I wonder if we actually know enough about is the wonderful pelvis. It's an amazing articulated piece of architecture, human architecture, where the baby passes through. And yet I really don't feel that we spend very much time on that at all. So do we know enough about that? And on the screen you can see there's a few pictures there. This is, I think, and I would say 80% of midwives and doctors will recognize these pictures here, the pelvis, the bony part of the pelvis, and the pelvic floor, or at least one layer of the pelvic floor that is taught, frequently taught in our training. And there's much more to it. And I think that this gap in our knowledge about the intricacies of the pelvis really affects how we help women when there's a labour dystocia, which is complicated by a biomechanical issue. There's always going to be a reason why that baby is not coming out. I mean, I've come to the conclusion very much in my practice over 20 odd years, working in the NHS with a lot of, attending a lot of births, that indeed 3 main disruptors of the birth process, which makes it very difficult, is fear, which is why I'm a hypnobirthing instructor, medicalisation for multiple layers there, that disrupts the process. And the other main disruptor is a biomechanical issue. What's stopping the baby come through the pelvis? And does this information that we are given in our training, does that help us to help the women and birthing people who are struggling with that? And I don't believe it is, not at all. And I'm going to show you what I think we need to know, well, what I know that we need to know. So this gives us an impression we've got a bony pelvis, of course we do, but it's much more interesting and more complex than what we're seeing in these pictures. These pictures, of course, are valuable too, I'm not dissing them, but we need to know more. What about that? I think that's amazing. And we are looking at multitude of layers of muscles. And what you can see there actually is fascia as well, which is connective tissue. And we'll go on and we'll have a look at ligaments as well. So we've got lots of things going on in the pelvis. It's not just a bony pelvis. And dimensions, it's got layers and layers that actually have an effect on how it sits in the body, and that will have an effect on how the baby passes through. In the larger the longer pictures here with the whole of the back and some of the leg, you can see that actually these muscles are actually attached to the pelvis. The pelvis is carrying our weight. It's doing it's doing a huge job, and it's going to take some battering through our lives as we pass through our lives. We have accidents, we do things, we've got bad posture, we do all sorts of things that are going to have an effect on the balance of that pelvis. And as you can see, the hamstrings are attached. Actually, they connect up to the sacrotuberous ligament here on the pelvis, on the ischiotuberosities, which then attach to the sacrum. So this is attached, or you could say we're attached from the foot all the way through to the top of our head in one line. We're all connected. Every muscle is joining every other muscle, and that plays a part in balance. So let's have a quick look at some of these muscles that are associated with balance. We have the psoas muscle. Did we learn about that in our training? I doubt very much. It might be some of the newer midwives have, and I hope that's true. I do speak to student midwives, and they are telling me they're learning a little bit more, which is amazing. And that's what we need to do. We need to investigate and explore much further. So the psoas muscle is the longest muscle we have that actually attaches the trunk to the leg, and it passes through the pelvis, and it also is, believe it or not, it's associated with the flight and fight response, and so it can tense up and not function very well if we have a lot of fear. Everything's connected, you see. It's fascinating stuff. Adductors from the inside of the knee pass right up onto the ischiotuberosities and hold the pelvis in place there. And if it's tight, that's going to pull and bring it out of balance a little bit. The gluteus maximus, the great, look at this, this is the back of the pelvis. This is the gluteus maximus, minimus and medius, and there are layers of them, these muscles onto the large hip bones. Notice that they're not on the sacrum itself. The sacrum hasn't got muscle across it, but the hip bones do. And the piriformis is attached to the sacrum, and then it goes through the pelvis onto the top of the femur. And then on top of that, we've got ligaments as well. So ligaments, connective tissue, which is covering all our muscles. And the broad ligament is one of those large ones that we have covering the uterus, holding it in place. The round ligaments, almost acting like guy ropes, in fact, are passing through into the mons pubis, some of the fibers, and into the labia. Uterosacral ligament, that's holding another one holding the uterus in position, attached to the sacrum and to the lower part of the uterus, in fact, the cervical area. And you can imagine if you have got an imbalance in your pelvis, that will affect how the uterus is sitting inside and how the space that the baby has available. We've also got the cardinal ligaments. Can't see it in that picture, but the cardinal ligaments are very important ligaments. They are attached to the sides of the pelvis, and they merge a little with the uterosacral ligaments, and they again holding the uterus in position. And I love this picture. This is the back of the pelvis. again, you saw the muscles there. We talked about the gluteus minimus, medius, and maximus, and the piriformis. And that's the sacrum covered in ligaments. And of course, we've got everything we need to give birth. We have all the hormones, and the hormones, relaxin and prostaglandin, they are helping us to be more relaxed. Our ligaments are more relaxed in our bodies when we're pregnant, and that means that they can move and make more space as the baby grows and passes through the pelvis during the birth process. We talk about the ischial spines, and I think it's really interesting that we know about the ischial spines, don't we? As in an imaginary line, really, to designate where the baby is in the pelvis. Is it high? Is it above the ischial spines? Is it lower? Yet we are very unaware of the fact that actually the ischial spine is a ligament attachment point. And I think that's really interesting. I'm sorry that we're not told that, because that would make a lot of sense. Because if you can feel an ischial spine, then that means that that part of the pelvis is being pulled inwards where it shouldn't really be, and therefore there is a restriction. And this is the kind of information that midwives really need to know about, because if we knew about that, then we can develop strategies and solutions to help women who are struggling with a labour dystocia. And in fact, we do have some of those hip opening and muscle releasing positions and techniques. But we're certainly at a disadvantage by not understanding how this pelvis moves. And this is, sorry, not a great slide here, but this is going to, we're talking now how it actually opens up. And I remember as a midwife, I used to say to women, oh, you know, don't worry, your pelvis is going to open. And I'm thinking, please don't ask me how, because I'm not quite sure. But it took me many years later and self-study to find out that actually nutation and counter-nutation is a thing. It's how the pelvis opens and moves and creates, increases dimensions. Just going to get my pelvis here and I'll show you this. This is the pelvis. Now, this is what we're talking about right now, is nutation. Now, nutation is this is the sacrum here, and the nutation means it's nodding forward. Now, of course, I'm grossly exaggerating, but you can see what happens. It nods forward, and if it nods forward, it decreases the inlet, this part, the brim, because it's nodding forward, but it's increasing the outlet, and that makes a difference, and we need to know about that. That's really important stuff. I'm going to just show you, and of course counter nutation is the opposite. So the counter nutation is pushes back like that, which means it's opening, it's making more space in the brim, but it's reducing the space here in the outlet. And who not many universities are teaching midwives about that, although it is coming, but we all need to know about it, and the doctors need to know about it, because it affects our practice, and we can hinder birth instead of facilitating this process. We can actually make it more difficult. Let's have a look. I'm just going to show you this little video as an animation of exactly what I've just been talking about, counter nutation and nutation. It doesn't have any sound, so it's about 2 minutes, so I'm just going to share that with you. And towards the end, you'll see it's actually talking about rotation of the femur as well, and that is really significant. So you can see it's separate, these bones are separate, joined together with ligaments. That's going backwards, and the hip bones are flaring open, so they're increasing the dimension at the brim, and nutation does the opposite. and that moves the ischiotuberosities, which is your sit bones, and it opens it up, opens up the outlet, making more space for the baby to come through. You see how the hip bones move together there. They come opening that brim, which means they're reducing the outlet, or they're doing the opposite. And it's just seeing it from a different viewpoint there from the side. There you are, nutation. Tailbone's going out, making more space. And of course, we've got the pubic symphysis pubis as well. And that's creating more space so we can have space. Of course we can. We're built for this. And this is femoral rotation. Now, this is really important because there's something that midwives do a lot of. You see how they're rotating. So rotating your, or abducting your legs. Look at this. You see how it brings those ischiotuberosities inwards. So abducting your legs, and the midwife says, open your legs and make more space. It's actually doing the opposite. And that is why it's very hard for us if we haven't got that information in our training. We say things that make sense to us because open your legs to us makes us feel like you're making more space. But in fact, it's doing the opposite. So abducting the legs, the femurs, is going to reduce the outlet. It's bringing the tuberosities together. You can try that by sitting on your hands and opening up, doing that very thing of opening up your legs and paying attention to where your ischiotuberosities are moving. Now, it's only a little bit, but a little bit of space means a lot when you're having a baby, doesn't it? If you had to rotate your femurs, and putting your knees, pointing your knees towards each other and your toes towards each other, and that's rotating your femurs, and that does the opposite. That's actually going to open that space up. Now, of course, women and birthing people, often left to their own devices, will do it instinctively. And to me, that's the ultimate thing, is that we actually have environments and a belief in the physiology and an understanding in the physiology, so that we can help women and birthing people to be free to move and find their own solution if they're having a struggle. And if they are unable to do that, then we can step in and offer assistance if we know how to. So I want us just to reflect on a few questions. I think just to check my timing here, this is a snapshot. Of course, we only have a short time to discuss this really large subject, but I want to just put these questions to you to reflect on what we've just been talking about. What are the causes of pelvic imbalance? So there are causes, and we can find that out when we first book women into the system and we have a chat with them about their health and so on. We could be finding that out. And I'll talk about that in a wee minute. But things that I would like you to reflect on later is, how does the pelvic imbalance influence the baby's position? How does it impact the baby's journey through the pelvis? And which midwifery and obstetric practices negatively affect pelvic dimensions? Well, I just mentioned one that is really frequently used, isn't it? Open your legs, make more space. It's doing the opposite because we don't understand how the pelvis moves. And how can we optimize the biomechanical aspect of the birthing process? Well, there we have one of the main culprits. Sedentary lifestyle. And what are we doing in the pandemic? We're all sitting, aren't we? We're all sitting a lot more. We're all just, sinking in to those soft buzz. And it's not doing us any good. It's not doing our pelvises any good. And if you are pregnant, then that's going to have an impact. And here are the other impacts that imbalance, or the other reasons for imbalance. We have sacroiliac dysfunction. Now, the sacroiliac joint is the joint between the sacrum and the ilium, the big hip bones. And this is a known thing. I mean, talk to any physio, osteopath, or chiropractor, or look it up. Sacroiliac dysfunction exists, and it's quite a common event in our lives because of wear and tear and going through lives not particularly with good posture and so on. And that's going to have an effect on the quality of the joint. Tight ligaments, tight muscles, a twisted pelvis, overtoned muscles. Those fitness instructors, dancers who are doing it professionally all the time are overtoned and ultra fit. And you think, oh, well, they're going to do well because they're so fit. But actually, they do sometimes run into problems. Now, I'm not suggesting that everybody who has had a fall, or every horse rider will have issues. I'm not suggesting that at all, but I am saying that they have a higher chance of running into difficulties, biomechanical difficulties, when the baby's coming through because of their profession or their lifestyle. Accidents and injuries, you see, falling on your bum, but not just falling on your bum. What about actually breaking your ankle? You remember your ankle, your Achilles tendon is attached to your calf muscle, which runs up and is attached to the ligament that then at the knee that attached to the hamstrings, and that runs and covered in connective tissue, fascia, that then thickens at the end to become another ligament, which is the tuberous ligament at the top, which goes on to connect to the sacrum. And that all has an impact. So if somebody's broken their ankle, they may have a higher chance of having a biomechanical issue in their birth. And we want to know about that, don't we? We want to know about that so we can then advise them. And this is what we can do in antenatal care. In our pregnancy care, we can advise them. We can say, not a great idea to cross your legs. Remember, they have that relaxing, everything's mobile and moving a little bit more, but if they can habitually take up postures that affect the balance of their pelvis, then they're more likely to run into problems. Crossing your legs is one of them, sitting too long. So getting up and moving around, and of course using a ball to sit on instead of that soft sofa, or to drape yourself over so your pelvis can be free. Standing with one weight or imbalanced on one hip, like maybe with your toddler on one hip while you're pregnant, is going to have an impact. And so we can, advise them how to carry their babies better, like on their back or on their front, or just, learn different ways of doing this that won't put them in jeopardy of becoming imbalanced. Wearing high heels shortens the calf legs, the calf muscles, as does sitting. And these are things that we need to know about and understand. And once we do understand, it all falls into place really easily. Wearing the right size bra. We don't want any constrictions right up in the respiratory diaphragm. Because congestion, it would be reflected into the pelvis. So who wears a bra anyway in a pandemic? But if you are going to wear one and you're pregnant, wear the right size bra. It is important. Swimming is important, but again, we are restricted, aren't we? Yoga, but the right kind of yoga. Yoga that is not strengthening and, we want pregnancy yoga that is releasing. And that's really quite important that we get the right kind. But walking, everybody can walk. I know we're in quite a tight lockdown at the minute, but there are, you can get out there, walk in flat shoes, and quite briskly. And walking is amazing. Everybody can afford it because it doesn't cost anything. And it is amazing. And it's very good for all of us. And of course, it lifts the spirits as well. Dancing, dance in the kitchen, put the funky music on, move your hips and really move and get to know the pelvis. We are so disconnected with our bodies because we're in front of screens, aren't we? A lot. We're on our phones and we don't pay attention. The women and the birthing people are not connecting very well, as so many of us, with our bodies, paying attention and feeling what is the pelvis doing can help you move more instinctively in birth when your baby is passing through your pelvis, because you know how that feels. A calf stretch is a very simple thing to do, and again, that's very good, especially if you are a bit sedentary, and keeping that at an optimal length. And of course, seeing a therapist if you have a history of injury. And I know that's tough as well, but that is the optimal care that you can give, is to suggest, advise a birthing person or a pregnant person to go and see an expert. We're not experts, but we should be signposting. Oh, thank you. So there's the birthing ball. Use it instead of a sofa. Knees slightly lower than the hips. The right size for the right person. Feet flat on the floor. Move it. It moves the sacrum. It decreases back pain. Vigorous circles in labour can aid fetal descent, and that's a really good thing if the baby is a bit high. I'm just going to nearly finish now, but this is very, very important, because I'm going to just reiterate, freedom to move is so important. The bed takes precedent. The bed is dominating the birthing room, and this is not good. Just talking about the physiology, talking about how our pelvises move, and here we are, 83% of us are giving birth on the bed. That's a CQC. 24% are giving birth to unassisted birth in lithotomy. Now, this is a problem. We need to be talking about this. Why are women and birthing people on the bed? I know they climb onto the bed, media is telling them that's where people give birth, but we need to disavow them of that image. We need to understand it better ourselves and get out of that habit of using the bed willy-nilly. Look at this birthing room here. It's an active room. And I'm done. I do teach the birthing parents, the pregnant parents, about this, because they need to know how their bodies work, how birth works, how their baby passes through their pelvis, what to look out for when things, what are the signs of a suboptimal position or a biomechanical issue in the pelvis. And actually, midwives are not great at that either, but I learned a lot from the women through many, many years of attending births, attending complex births. And of course, everybody used to say, oh, Molly, that's one for you. That's great. It was hard work, but I was very grateful for that opportunity to do a lot of observing and learning about what are the signs without doing any VEs. You can tell, because and we all know those signs, but we have no time to talk about that because we are moving on, and I'm just going to stop sharing now. There we are. Quick flash snapshot.
Molly, that was fantastic. Thank you so much, and thank you for raising the issue of women and the CQC report, because even the most recent one was talking about women who'd reported they'd given birth in lithotomy. And every time I read anything like that, my teeth go on edge. It's just, one, it's very undignified if you don't need to be in that position.
Absolutely.
And twice, it doesn't work.
No, it doesn't. It compresses the sacrum, and then you're abducting those legs. So it's anti-gravity. Making less space, and the women and birthing people will push that baby out, but at what cost?
Yeah.
At what cost?
Yeah.
You know, that's the thing. Are we causing more damage?
Yeah.
Will be revealed later with pelvic floor trauma.
Yeah. I think that's really, really helpful. And I love that last image of a proper birthing room with the bed firmly to the side. That's fantastic.
Absolutely, and we can do that.
We have one question so far that because we've only got really 1 minute for that, and that's from Lauren says, thank you so much, Molly, that was brilliant. Yes, I agree with that, absolutely. And Maria O'Malley says, antenatally, is there a swimming stroke that is harmful? Good question.
It's a very good question. I mean, I can't say I'm an absolute expert, but I do believe that breaststroke with your head up is probably not a great one to do. So you should be more aligned. So backstroke and a proper crawl, or a proper breaststroke where your head is down, so you're not, you know. So yes, there are there are probably strokes that are better than others. I'm not an expert in that, but I'm just thinking off the top of my head, and what other conversations I've had is I do believe unless you're doing it properly, the breaststroke is not going to be that helpful.
Fabulous. Thank you so much. And I'm very pleased. I know I could listen, well, both to Claire and to you for a lot longer, and we're very limited to time, but I'm very happy to tell the audience that Molly is coming to the All Ireland festival also, and is going to sort of continue her little sort of foray into the
Yes.
And I have to say, I know as a teacher, I mean, I'm always very keen on physiology and anatomy, because I think if you understand how it works, help women. But I also know that a lot of this sort of material is being left to students to learn on their own. It's quite difficult if you're on your own.
And it is difficult. And really, why on earth should it not be part of our training? It should be. It's a really essential element. And well, it's too much to talk about right now, but I do talk about that in my courses because it is actually a feminist issue. It is political. I'm going to say something maybe a wee bit controversial, but or not. I mean, we didn't know the size of the clitoris until 1996. You know, that says a lot about women's bodies and what we know about women's bodies. And our expertise is childbirth, and we need to know about the pelvis. And it's quite startling. And I'd say it's a travesty that we don't have this information in our training.
Well, I think there's going to be a bit of a Twitter storm after that, Molly. I love the human architecture and the great respect and love you have for that pelvis. It's fantastic. I've really enjoyed your session. Thank you so much for coming.
Thank you.
We have to gallopy on.